Hello. Wishing you a happy, healthy day full of energy. Please like and subscribe to us. Following your health practitioner's advice will help you reduce your risk of cardiovascular disease and maintain a healthy heart. If you have any unusual signs or symptoms, see your doctor immediately. 1. Dyspnea. Shortness of breath. A common symptom of heart failure. Can have many different causes and effects on the circulatory system. Heart failure is a condition in which the heart cannot pump blood effectively, leading to a buildup of blood and fluid in the body. Here's an analysis of how shortness of breath leads to heart failure, and how it affects the circulatory system. Causes of shortness of breath in heart failure. Left heart failure. When the left ventricle cannot pump blood effectively, blood will pool in the lungs, causing increased pressure in the pulmonary capillaries and leading to pulmonary edema. This is a major cause of shortness of breath. Right heart failure. This condition is often the result of left heart failure. When the right ventricle cannot pump blood effectively, blood will pool in the veins and cause swelling in the body. Reduced contractility of the heart. When the heart muscle is weakened, usually due to damage or disease, the heart cannot contract strongly enough to push blood, causing shortness of breath due to reduced oxygen supply to the tissues and muscles. Mandarin affects the blood circulatory system. Increased pulmonary venous pressure. Shortness of breath due to left heart failure leads to increased pressure in the pulmonary veins, causing fluid to seep through the pulmonary capillaries into the air sacs, causing pulmonary edema and acute difficulty breathing. Reduced blood flow to organs. When the heart cannot pump blood effectively, blood flow to organs and tissues in the body is reduced, causing a lack of oxygen and nutrients. This can lead to fatigue, weakness, and organ damage. Fluid accumulation in the body. Right heart failure leads to fluid accumulation in the body, causing swelling in the legs, abdomen, and liver. This increases venous pressure and causes additional difficulty breathing due to pressure on the lungs. Increased sympathetic system activity. When the heart does not pump blood effectively, the body responds by activating the sympathetic system to increase heart rate and contract blood vessels. However, this also increases the burden on the heart and can lead to a faster decline in heart function. Reduced gas exchange. Pulmonary edema and increased pressure in the pulmonary capillaries reduce gas exchange in the lungs, leading to decreased oxygen in the blood and severe shortness of breath. Long-term consequences. Reduced mobility. Shortness of breath and fatigue due to heart failure reduce the patient's mobility and quality of life. Increased risk of complications. Patients with heart failure are at increased risk for complications such as myocardial infarction, stroke, and kidney failure. Increased mortality rate. Heart failure is one of the main causes of death, especially if not managed and treated promptly. Shortness of breath is not only a symptom of heart failure, but also a contributing factor to worsening heart failure. Understanding this relationship helps improve the treatment and management of heart failure patients. 2. Fatigue and weakness. Heart failure is a medical condition in which the heart cannot pump enough blood to meet the body's needs. Fatigue and weakness are common symptoms of heart failure, and they can significantly affect the circulatory system. Here's a breakdown of how heart failure and related symptoms like fatigue and weakness affect the circulatory system. Reduces the heart's ability to pump blood. In heart failure, the heart's ability to pump blood is reduced. This means insufficient blood supply. The heart cannot pump enough blood to organs and tissues in the body, leading to a lack of oxygen and nutrients. Blood accumulation. Blood can accumulate in the heart, lungs, and other organs, causing symptoms such as shortness of breath and swelling. Reduced blood flow to muscles and tissues. Fatigue. When blood flow is reduced, muscles and tissues do not receive enough oxygen and nutrients, leading to fatigue and weakness. The muscles do not have enough energy to function effectively, making the patient feel tired even when performing simple daily activities. Weakness. Due to lack of blood and oxygen, the body cannot maintain strength and endurance, making the person feel weak and have difficulty maintaining physical activity. Affects the blood circulatory system. Increased pressure in the veins. When the heart doesn't pump blood effectively, blood can pool in the veins, especially in the legs and abdomen, leading to swelling and a feeling of heaviness. Blood stagnation in the lungs. Heart failure can cause blood stagnation in the lungs, increasing lung pressure and causing shortness of breath and dry cough. Body reaction. Activate the sympathetic nervous system. When the heart does not pump blood effectively, the body will activate the sympathetic nervous system to increase heart rate and constrict blood vessels to improve blood flow. However, this can make the heart work harder and cause further damage. Stimulates the renin-angiotensin-aldosterone system. This system will increase hormone production to retain water and salt, increasing blood volume and pressure, but at the same time can lead to increased burden on the heart and worsen heart failure worse. Conclude. Fatigue and weakness are common and notable symptoms of heart failure, reflecting the heart's reduced ability to pump blood. They cause a variety of negative effects on the circulatory system, reducing blood flow to muscles and tissues, increasing pressure in the veins and lungs, and triggering unwanted physiological reactions. Understanding these mechanisms helps medicine to propose more effective treatment and management methods for heart failure patients. Signs of edema leading to heart failure. Difficulty breathing, dyspnea. Difficulty breathing, especially when exerting yourself or lying down, is a common sign of heart failure. This occurs due to a buildup of fluid in the lungs, pulmonary edema, when the heart does not pump enough blood to the body. Peripheral edema. Edema in the legs, ankles and feet is a symptom of right heart failure. When the right heart cannot pump enough blood, fluid can accumulate in the peripheral tissues. Rapid weight gain. Rapid weight gain may be due to fluid buildup in the body, a sign of heart failure. Fatigue and weakness. When the heart is not able to supply oxygen-rich blood to organs and tissues, the person will feel tired and weak. Fast or irregular heartbeat. Fast or irregular heartbeat, arrhythmia, can be a sign of heart failure. Persistent coughing and wheezing. Persistent coughing or wheezing, especially when lying down, can be a sign of fluid buildup in the lungs. Affects the blood circulatory system. Reduced blood flow. A weakened heart leads to a reduced ability to pump blood, causing insufficient blood flow to meet the body's needs. This reduces the supply of oxygen and nutrients to organs and tissues. Increased pressure in the veins. When the heart does not pump blood effectively, pressure in the veins becomes higher, leading to fluid buildup in tissues and edema. Fluid retention. Accumulation of fluid in organs and tissues, such as the lungs, causing pulmonary edema, and the periphery, causing peripheral edema, reducing gas exchange and causing difficulty breathing. Reduced circulatory efficiency. When the heart's pumping ability is reduced, vital organs such as the kidneys, liver, and brain may not receive enough blood to function properly, leading to impaired function of these organs. Ischemia. Ischemia can occur when organs and tissues do not receive enough oxygen and nutrients due to reduced blood flow, causing problems such as chest pain, angina, and organ damage. Heart failure and associated edema have a profound impact on the circulatory system. The heart's reduced ability to pump blood causes a variety of problems such as reduced blood flow, increased venous pressure, and fluid retention, leading to reduced oxygen and nutrient delivery to organs and tissues, thereby reducing the body's performance and cause serious clinical symptoms. Increased heart rate. Increased heart rate is a condition in which the heart beats faster than normal. When increased heart rate is prolonged or occurs frequently, it can cause serious effects on the circulatory system and lead to heart failure. Below is an analysis of the signs of increased heart rate and how it affects the circulatory system, leading to heart failure. Signs of increased heart rate. Tachycardia. Heart beats faster than 100 beats minute at rest. Nervousness or palpitations. Feeling of the heart beating strongly or skipping a beat. Dizziness or lightheadedness. Lack of blood supply to the brain due to ineffective rapid heartbeat. Difficulty breathing. Difficulty taking deep breaths. Feeling short of breath. Fatigue. The body feels tired and lacks energy. Chest pain. There may be pain or discomfort in the chest area. Effects of increased heart rate on the blood circulatory system. Reduces the heart's pumping efficiency. When the heart rate increases, especially over long periods of time, the heart's chambers do not have enough time to fill with blood before pumping it out. This leads to Reduced blood supply. The heart cannot provide enough oxygen-rich blood to organs and tissues in the body. Increased pressure on the heart. The heart has to work harder to maintain blood supply, leading to damage to the heart muscle over time. Affects blood flow. Increased heart rate leads to a decrease in the volume of blood pumped with each contraction. Reduced blood flow can cause ischemia in vital organs. Reduced oxygen supply. Organs, especially the brain and kidneys, may not receive enough oxygen to function properly, leading to decreased function. Leads to heart failure. Heart failure occurs when the heart is no longer able to pump blood strongly enough to meet the body's needs. Persistent increased heart rate can lead to heart failure through the following mechanisms. Impaired myocardial function. Hypertrophy. The heart has to work too hard to pump blood, leading to heart muscle hypertrophy. The heart muscle thickens but does not get stronger, but on the contrary, becomes weaker and less effective. Fibrosis. Prolonged increased heart rate causes myocardial damage and fibrosis, reducing the heart's ability to contract and expand. Increases the burden on the heart. Increased blood vessel pressure. Prolonged increased heart rate can cause increased pressure in the vascular system, increasing the burden on the heart. Coronary artery disease. Persistent increased heart rate can lead to coronary artery disease, which reduces blood flow to the heart, causing myocardial ischemia and leading to heart failure. Conclude. Prolonged increased heart rate can cause serious effects on the circulatory system and lead to heart failure. It is important to recognize the signs of increased heart rate and treat it promptly to prevent dangerous complications for the heart and circulatory system. Maintaining a healthy lifestyle, managing stress, and regularly monitoring your heart health are important ways to prevent heart failure.